All those years you were also advising and advocating patients and their families. Probably you witnessed a lot of very positive and also tragic stories as prohibition is violating the human rights, right?
So I work with, come from Texas, where Texas is one of the last states with the least access to medical treatments using cannabis plant. So many families in very complex medical conditions were leaving and going north to Colorado, where they had full access and could get better services related to their condition. So what I've seen is a mother of 2 children, one who is chronically ill, who has seizure disorder. This is a mother who's unable to work because her child is hospitalized 9 times in a year. Each of those hospitalizations last 5 to 10 days. So she's unable to hold a full-time job because she must be with her child and administer care and concern while they're hospitalized for their very complex condition. This is without access to cannabis. They're hospitalized 9 times in a year. See, the same family moved to Colorado, has access to medicinal cannabis for their condition. The child has 0 hospitalizations in 1 year. The child is able to return to school basically full time. The mother is able to return to work, but what we see is a return to stability in the family. Family is no longer dependent on state services. The family is no longer stressed by medical crises. The family is no longer a financial burden by the fact of its medical crisis that it can't afford, so the state must financially support. We see a stronger family unity because the family is not fractured between hospital and home. We see less depression because the family isn't battling a chronic medical crisis all the time, and they're able to function as a normal family.
We don't have obviously the same human rights standards. If a patient in one country has all rights as a patient, and in another country he can go even to the prison for using the same plant, the same substance.
Just look at the United States. Like I said, Texas, one state, one very large state inside the USA, and Colorado. 2 states within the same system with different laws that one can criminalize you and one can give you medicinal access. In Germany, we're seeing the case where the law permits medicinal access, but one patient may have insurance that pays for it and one patient may not. And the burden of the financial cost is too much, and they really still can't have access, even though legally they should be able to have access. So we still see inequalities even within systems that have legalized. I want to read something about the universality of human rights. This is from Article 1 of the Universal Declarations of Human Rights from 1948. All human beings are born free and equal in dignity and rights. They are endowed with reason and conscience and should act towards one another in a spirit of brotherhood.
Could you point out which human rights are violated under the prohibition?
First of all, a crime needs to exist. People using drugs is not a criminal act. The state, the nation cannot be a victim of its own laws. So unless someone is committing a crime against another person, we would contend that a crime hasn't occurred. With prohibition, We have violation of bodily integrity, meaning I have the right to put into my body as I see fit, and against arbitrary arrest. We see arbitrary arrest simply for consumption of a substance into our own bodies. Again, no victim, no crime. The war on drugs has been a war against people of color and the impoverished. Imprisonment and forced labor as a result of being arrested and criminalized for use of a substance were then subjected to inhumane conditions of incarceration as well as forced labor within that incarceration system. In some countries, we still see torture and execution, as is in the example of the Philippines or Russia, and a couple of other countries where you can be executed simply for being accused of trafficking if there was no trafficking intent. It's an unfair judicial system. And as far as where healthcare and the service programs interface, we see lack of harm reduction for drug users, and we look at this in the context not just of cannabis, but those that use other substances, other plant-based substances, and even in other deemed illicit substances like heroin or psilocybin. We need what we're seeing is a lack of pain management, even though the WHO is supposed to mandate that countries have accessible pain management programs. Many of the impoverished nations choose to not provide access to deemed illicit substances, thereby continuing to further the pain management problem inside of their own countries, and interference with people who use drugs in their family situations, the taking of children away from mothers, and that's another collateral problem with incarceration, is that we're taking children's parents and their familial system and we're breaking them up, thereby subjecting them to more opportunity of poverty, systemic abuse, sexual abuse, and neglect abuse situations.